September 10th, Freedom Day in Denmark. That day, the Nordic country ditches all COVID curbs. 50,000 Danes celebrate the first post-pandemic free concert in Copenhagen. I only thought about COVID-19 for a second when I arrived. Like, wow, there's a lot of people here. But I've totally forgotten about it. It's just so awesome to be here. Denmark is the first country in Europe to drop all coronavirus restrictions. Vaccine passports are no longer needed to enter bars, restaurants or nightclubs. 74% of all people are fully vaccinated. And with a very low COVID reproduction rate, officials say the virus is now under control. Welcome to your COVID-19 special. I'm Chris Kober in Berlin. No longer a socially critical disease. That is the Danish government's assessment of COVID-19. After more than 540 days with restrictions to limit the spread of the coronavirus, Denmark's high vaccination rate has enabled citizens to return to pre-pandemic life, at least inside the country.
This is where the man works whose job it is to explain the pandemic to the Danes. Virologist Allan Randrup. He's convinced that the rapid lockdown in March 2020 spared the country the worst.
I was in the studio of one of the Danish television channels the evening that our Prime Minister announced that we would have the complete shutdown of Denmark. I think it was the right thing, and actually a big part of the reason why we have had such a relatively mild course compared to others.
Now the government has announced that COVID-19 no longer poses a national threat. And suddenly the corona passes and masks have vanished from Denmark's streets. The main reason for this radical opening is the high vaccination rate among citizens and the authorities' detailed information campaign and all measures taken.
Among the most vulnerable of our patients and citizens, the vaccination rate is more than 9 out of 10. And in the general population, it's more than 8 out of 10. One thing that I think we did very good here and that people might learn from is the transparency of the effort. But it might also be the culture that when the Danish healthcare authorities recommend something, usually the Danish people do it.
Germany's vaccination rate is quite a bit lower, as is citizens' trust in the authorities. That would make a complete opening such as in Denmark less advisable. Now throngs of joyful Danes are headed back to amusement parks. Many of them are pleased with the government's handling of the crisis.
I believe that they've handled it from the intention of doing it best possible. So I think on the whole, I think they've done well.
COVID testing continues. Some experts propose monitoring wastewater to localize future outbreaks. While Germans might balk at this kind of surveillance, the Danish state is already highly digitalized, making it better equipped to respond to the pandemic.
We have a register of everybody who tests positive in a laboratory with the disease. We also have a register of who's vaccinated. And we have a population register, so we know where everybody lives and we can contact people directly. When I talk to colleagues in other countries, I can really see that has given us an edge. That is a particular thing of Denmark, which has helped us.
But these days, many ordinary Danes are diving headlong back into the lifestyles they were living before and hoping they've finally gotten COVID under control.
Let's talk about how the Danes did it with Camilla Holtenmøller. She's a medical doctor and head of the expert group for mathematical modeling of COVID-19 at Denmark's Statens Serum Institute. Welcome to DW, Camilla. For the moment, the pandemic seems to be under control. What are the key elements that Denmark apparently got right in order to get to this point?
I think very importantly, in the springtime, we had a really large test capacity. We did massive test screening, both in schools and in workplaces, which allowed us simply to track the infected persons very locally. And we had some local lockdowns that also worked very effectively, which we were able to do simply because of this screening test or test strategy we had in Denmark.
There seems to be a predominant feeling of trust among the Danish public, trust when it comes to authorities and the way they've been handling the pandemic. Where does this trust stem from?
I think historically the Danes in general have a very high trust in the health authorities and also in other vaccination campaigns. For instance, vaccination of children, there's a very high trust and support of the program. And I think that really also helps us in the current situation with COVID.
In many places, people are skeptical when it comes to getting vaccinated against the coronavirus. Now, looking at Denmark's high vaccination rate, which is one of the highest in the world, things appear to be different somewhat. Why is that?
I think, first of all, is definitely related to the high trust, both in health authorities, but also in general to vaccination programs and vaccination in general. But I think we had some really nice campaigns here in Denmark and really informing very nicely about the vaccines and a lot of transparency, and also that this is a free choice to get vaccinated. I think that has helped us a lot.
And Camilla, particularly young people, now among them, the vaccination rate is lower than the total average. If they can now go back to clubs and bars without any restrictions, could they become the new drivers of this pandemic?
Well, I take it that no doubt about it that the unvaccinated will definitely be a driver of the epidemic, and especially also children who are not to be vaccinated, children below 12. Amongst the young ones, especially, is their way of behaving, of course, going to clubs and bars when they're really close together. But definitely that will be an issue. And of course, we try to strive towards having the highest vaccination coverage as possible in those groups as well.
Does Denmark specifically target these people who are eligible for a vaccination but have chosen not to get the jab so far?
Yes, there is definitely a large campaign going on. So first of all, making vaccination available. We have vaccination in high schools. We have vaccination in supermarkets. So vaccination is really available everywhere. You have drop-in vaccination. But of course also campaigns on social media, which is also important to reach out to these groups.
Now, more than around 3/4 of the Danish population are fully vaccinated. What does that mean going into the fall and going into the winter where infections rose in the past?
I think what is really important in that story is, as well, is that we have a very high vaccination coverage, especially in the risk groups and in old people who are at risk of having a severe COVID situation, a COVID infection. That is really important. And of course, it's also important that we just in general have a high coverage in above 50 years old as well. That is the main goal.
Camilla, having regained their freedom, would the Danes go back into lockdown if infections spiked again?
Of course, I think they would if it became necessary, but I don't think it will become necessary. I mean, we have a really good experience that we can do well with local lockdowns, and also we have proven that this really large test system allows us to do more local lockdowns instead of these large national lockdowns. I think we will go further with that, and that will hopefully be successful in case it should be needed.
Camilla Holten-Møller of the Statens Serum Institute in Copenhagen. Camilla, thank you for talking to us. Now, while the Danes may be further ahead than others on their way out of the pandemic, there is the issue of how much longer we are going to have to deal with this. Here's our science correspondent, Derrick Williams, answering one of your questions.
How long do most pandemics last?
To make any predictions about how the COVID-19 pandemic could end, it makes sense to look at past pandemics, since they provide data that could potentially help us predict how long the current one might last. Experts trying to do that tend to focus on the 4 officially recognized respiratory disease pandemics that have occurred in the last 100 years, which were all driven by an old enemy of humanity, influenza. The most recent one was in 2009, when a novel flu strain, commonly called the swine flu, swept the globe, infecting, by some estimates, up to 1 in 5 people on the planet. Top-end guesses say it might have caused close to 600,000 deaths in the 14 or so months that it raged. The swine flu pandemic was shorter than a flu pandemic in 1968, often called the Hong Kong flu. It was caused by a strain that killed at least 1 million people worldwide, possibly many more. All in all, it lasted a little less than 2 years. A decade before that, a strain that became widely known as the Asian flu killed a similar number of people in the late 1950s. Now, what was really interesting about that pandemic was that it was the first where vaccines played a key role. It's thought that their quick development and distribution saved potentially hundreds of thousands of lives. Finally, there was the granddaddy of all modern flu pandemics, the one that devastated the planet at the end of the First World War, starting in around 1918. It's viewed as the most severe pandemic in recent history. That flu strain infected, we think, around 1/3 of the world's population and killed at least 50 million people over the course of around 3 years. So, to sum it up, those recent pandemics lasted between around a year and 3 years, but they were, of course, caused by flu viruses, not coronaviruses. So trying to draw parallels with the current pandemic, experts say, is a tenuous move at best.
And that's our show. For more, check out our website at dw.com/COVID-19. For now, thanks for watching. Stay safe.